Welcome back to Primetime News and a special welcome to those watching on onespotmedia.com. We begin with news that the country's fight against COVID-19 has hit yet another crossroad. With the increasing hospitalizations, medical facilities are now running low on oxygen. Anthony Lugg has our report.
Every second without sufficient oxygen at hospitals could mean life or death. It's the reality the country is currently facing. On Saturday, TVJ News was informed that several hospitals across the island were running low on medical oxygen amid a surge in COVID-19 cases. It's understood that Jamaica's sole producer of medical oxygen, IGL, has been having challenges in supplying hospitals with the commodity. In an interview with our news center, Health Minister Dr. Christopher Tufton confirmed the news. He pointed to the increase in COVID-19 hospitalizations.
In keeping with the features of the virus, high flow oxygen is required, so there's a very big demand for oxygen. So hospitals are using 2 to 3 times what they would normally use. The sole supplier, IGL, even though they have made efforts to increase their output and have actually done so, are having some issues keeping up with the demand. And in the case of bulk oxygen, their sourcing of that commodity externally are having challenges because those markets are also under pressure and are giving preference to their local populations and hospitals.
The development coincides with a declaration by the Health Ministry on Friday that public hospitals will only be conducting emergency services as COVID cases exceed current capacity for isolation. But how are hospitals responding to the situation, which some say has reached crisis level?
So we are faced with a challenge. Having said that, the team are working to respond by moving around the mobile cylinders to where it's needed most, and to constantly, work with IGL for deliveries and based on their capacity to produce.
In the meantime, IGL says despite running low on oxygen, production is ongoing at its plant. The company says it expects that the situation will be remedied by Monday. As the country awaits the arrival of the oxygen supply, healthcare workers will have to make do with what's left of the gas at their respective facilities. Anthony Lugg, TVJ News.